During an emergency, at home, or on the battlefield, every single second is crucial. Every choice can potentially save a life. How is the Navy working to prepare corpsmen for operational readiness? Real trauma training demands real trauma. The Hospital Corpsman Trauma Training Program, known as HMTT, stands as one of the elite training courses in Navy medicine and is managed by NMOTC, the Navy Medicine Operational Training Command. The HMTT program has been forged through a nationwide partnership with Level 1 trauma centers, such as WakeMed in Raleigh, North Carolina, Great Lakes Naval Station in conjunction with John H. Stroger Jr., Hospital of Cook County Health in Chicago, Illinois, the University of Florida Health Shands Hospital in Jacksonville, Florida, and the University Hospital Cleveland Medical Center in Cleveland, Ohio. Working with civilian trauma centers offers collaborative opportunities for hospital corpsmen to receive robust clinical training with hands-on exposure to real trauma patients with similar injuries to those encountered on the battlefield and aboard ships. However, the added benefit is the Level 1 trauma centers are also typically equipped with the latest technology, including high-fidelity simulation training and inpatient rooms with the latest innovations. This prepares corpsmen to serve above and beyond with the skills necessary to answer the call of duty. What started as a groundbreaking concept back in 2017 has now become the HMTT program, the Navy's premier program for trauma-specific training for hospital corpsmen. Incoming corpsmen come to HMTT from commands around the world. Some are recent graduates from A School at Naval Hospital Corps Schools or C Schools. Others have experience serving at Navy and Marine Corps commands and military treatment facilities and are seeking advanced trauma training. The 7-week immersive training journey begins with an intensive 2 weeks dedicated to didactic training to help prepare them for rotations. During this stage, hospital corpsmen collaborate closely with civilian staff and Navy instructors in order to deliver optimal care to trauma patients who are critically injured. The HMTT course equips corpsmen with the skills to properly identify and address primary and secondary injuries associated with, but not limited to, unconsciousness, blunt force trauma, gunshot and penetrating wounds, vehicular accidents, severe burns, significant falls, and other injuries. As part of their clinical rotations, these corpsmen work in emergency rooms, operating rooms, intensive care units, inpatient wound and burn units, and in various other settings. Every rotation at a Level 1 trauma center contributes to the development of the corpsmen's medical proficiency, simultaneously bolstering their resilience to confront highly challenging cases. By training's end, a corpsman isn't just proficient in medical procedures, they are better prepared to become the sole decision makers in life-threatening scenarios in austere or operational environments. By exposing corpsmen to more than just simulations of trauma, it shapes the very core of their trauma readiness, better preparing them to care for sailors and Marines. Upon completion of the program, hospital corpsmen are more confident and more prepared to assess trauma injuries, recognize and intervene in the management of shock, perform trauma resuscitation procedures, perform the continuous assessment and management of trauma patients, and apply the principles learned in a high-stress environment. This training also comes at no cost to the participant's parent command, thanks to the cross-organizational funding provided by the Navy Medicine Operational Training Command. From its inception, the Hospital Corpsman Trauma Training Program has been a vision-setting initiative, closing the gap between perceived and actual trauma readiness. With hundreds of graduates already making an impact in the fleet and, where it counts, incoming corpsmen continue to shape the future of Navy trauma care. For more information about the Hospital Corpsman Trauma Training Program, please visit our website.